Dental Office Emergency Case Study Project, Epistaxis, by Maddisyn Taylor and assistants Emily, Taylor, and DJ. A patient arrives for their routine cleaning appointment. Upon review of their medical history, the patient states they have been suffering from a sinus infection. The hygienist begins the prophy and the patient experiences an epistaxis event. The patient arrives on time for her dental cleaning appointment. The clinician introduces herself and begins to review the medical health history. The patient informs the hygienist that she has recently been suffering from a sinus infection. The hygienist acquires further information and begins collecting the pulse, respiration, and blood pressure readings. She determines the patient is healthy and that all vitals are within normal limits. After proper documentation has been recorded, the hygienist leans the patient back and begins performing the prophy treatment. Several minutes into the procedure, the patient experiences an epistaxis event. The clinician notices blood coming out of the patient's nostril and quickly puts down her instruments. She places the patient in an upright position and alerts a dental team member to retrieve an ice pack and basin. While remaining calm, the clinician informs the patient to tilt her head slightly forward and apply pressure to the lower part of her nose. She encourages the patient to breathe through her mouth and also provides a basin for her to spit out any excess blood or saliva she has. The patient continues to apply direct pressure with her head tilted forward, and after 15 to 20 minutes of direct pressure, the clinician places an ice pack over the bridge of her nose, and the epistaxis event subsides. Epistaxis is a condition most often referred to as a nosebleed. The severity of these conditions can range from minor to life-threatening. 80% of epistaxis events are idiopathic, which means there is an unknown origin. The most common occurrence of epistaxis is in children, and this is due to digital manipulation or nose picking. When epistaxis occurs in adults, the condition will be more severe. It is also common that epistaxis is seen in the winter and fall months due to the dry, cold weather outside. Epistaxis can be caused by local or systemic factors. Local factors include allergies, cocaine, environmental irritants, foreign bodies, nasal sprays, septal deviation or perforation, digital manipulation, trauma, upper respiratory infections, sneezing, and neoplasms. Systemic factors are more serious and severe, and these can include anemia, anticoagulant therapy, arteriosclerosis, alcohol consumption, hypertension, blood dyscrasia, and COPD. Epistaxis can occur in either the anterior or the posterior region. When it occurs in the anterior region, it will take place at the Kieselbach's plexus. This is a group of blood vessels that are located anterior to the septal wall. 85% of epistaxis events occur in the anterior region, and these are the easiest to manage. In the posterior region, it will occur at the Woodruff's plexus. This condition is more difficult to manage than the anterior region and is most often seen in geriatric individuals. Signs and symptoms of anterior nosebleeds include oozing and bright red blood. When it occurs in the posterior region, the patient may experience profuse bleeding, dark red blood, gagging, vomiting, or coughing, and often experience symptoms bilaterally in both nostrils. To treat epistaxis, the clinician will first identify the severity of the emergency. Next, they will perform and activate the CABs, circulation, airway, and breathing of CPR. They will then position the patient upright with their head tilted slightly forward, and they will have the patient apply direct pressure by pinching the lower part of their nose for 15 to 20 minutes. The clinician will inform the patient to breathe through their mouth and will also provide a basin for the patient to spit out any excess blood or saliva they may have. Lastly, the clinician will place an ice pack over the bridge of the patient's nose, and this will help with vasoconstriction as well. Most nosebleeds will stop with direct pressure. However, if the bleeding does not stop, it is important for the clinician to refer to the EMS for evaluation and further treatment of the patient. To prevent an epistaxis event from occurring, the clinician should inform the patient the following information. Keep the head elevated for 4 hours. Refrain from blowing the nose for several hours. Avoid any heavy lifting or bending at the waist for at least 24 hours. Use a humidifier at home to prevent any dryness from occurring in the air. Apply a pea-sized amount of lubricating cream to each nostril 1 to 3 times per day. Increase the amount of daily water intake, and avoid taking anticoagulant medications such as aspirin. Taking aspirin can increase bleeding, so the clinician should encourage the use of acetaminophen instead.